I'm Dr. Tara, and this is Hopeful Hints, a podcast where you'll receive quick, hopeful hints on all things women's health and infertility. Here, you will find education, inspiration, and most importantly, find peace and empowerment as you walk through the next steps in your healthcare journey. I'm back. It has been far too long since I have recorded a podcast episode. June of 2024, right before I went and had my endometriosis excision surgery. And so much has happened since then. And so many of you have had surgery since then. And I know I've been saying I was going to record this forever, but now's the perfect time. I'm going to dive in. This is a 4-part series. Okay. So hang tight, including answering over 40 questions from my Instagram followers, my patients. We're going to go over so many things in the next 4 episodes. So, this is for all of you who might even be unsure if you have endometriosis or adenomyosis. This is going to be for those of you who are teenagers, 20s, 30s, 40s, 50s, 60s, 70-year-old women. I don't care your age. If you are a female, I need you to listen to this episode, and I need you to share this episode and the next ones to come, specifically if you are going to move forward with surgery. But today's episode, I really want to focus on what endometriosis and adenomyosis is. I'm going to link a very in-depth episode, the number 1 episode on my podcast that I did with Dr. Adam Duke, who did end up being my surgeon 2 years after the recording of that episode. And we're going to dive into why this disease is so misunderstood in the medical community, why it is missed, and why that's not okay. It's unacceptable. Okay. It's 2025 almost at the time of recording this episode. It is unacceptable for healthcare providers to be dismissing and missing this disease and at the rate that they are. So let's dive in. Again, I want to reiterate, this is going to be a 4-part series. I'm going to take you through my journey of getting a diagnosis and into surgery and the conversations and decision I made to move forward with surgery. Part 2 is going to be the Q&A from patients. It's going to be longer. I'm going to also then in the following episode take you into preparing for surgery if you choose to go down that road. I'm going to take you through a caregiver perspective. I'm going to have my husband do an episode with me. I'm excited because he's never been on this podcast with me, and he was a huge reason why I was able to heal in a way that I did. And then I'm going to talk about post-op care and recovery and give you all the tips, links to tools that I use, so many things. So I'm going to take you through a journey. So I'm going to begin by taking you through the journey of endometriosis. And I'm going to save a lot of it because I want to keep these episodes short like they have been. And I'm going to again link the video and the previous episode that I think does the best job ever, and it's heard worldwide, that I did with Dr. Adam Duke. And we go from toes to nose through the journey in diagnosing endometriosis, why it's missed, why not every healthcare provider is able to do this surgery on you. I think that episode is super important and does a very good job of who you should be hiring as your excision surgeon. Because I don't care what degrees they have, if they are not resident trained in excision surgery, it's a red flag. And you really need to be considering who you allow to perform this surgery on you. Couple reasons. Number 1, they don't see it. They don't know how to even look for it when they're in your procedure. They are not trained to identify it. They will miss it. They don't excise it. They burn it or cauterize it. And that just is not okay anymore. There's enough advancement in research to know that that is not an okay method. And you really just want to be in the hands of the best. If you're going to go through this surgery, let's get you in the hands of the best healthcare provider and surgeon for that. Let's create this team approach for you. Let's talk about team. I was doing pelvic floor physical therapy acupuncture, some mind-body techniques before I even went into surgery. So I think it's really important to be doing those things before surgery because it was a long delay and gap in my decision to have surgery and me actually having it. Let's talk about why. Number one, insurance. A lot of you are worldwide, so maybe insurance isn't even, a conversation for you, but I need you to know that not every excision expert and excision specialist is going to be in network. And that might mean you have to wait till open enrollment to move to a plan that was covered. If you are local to the Midwest, let me share how my journey went. I was on a marketplace plan with Sanford Health. I do not recommend Sanford Health. They do not cover so many things that I see in our office with our patients, but let alone they do not cover a single excision expert, not one. Even in a plan that is supposed to be inclusive for you as a patient to pick who you see, they will deny every single provider that is a true excision expert. They want you to see their providers. To date of recording in 2024, there is not a single excision expert within that network. So I waited until open enrollment and switched to a Blue Cross Blue Shield plan. And all of them that I looked at for Blue Cross were inclusive to having a true excision expert. You really need to know that your healthcare plan has an excision specialist in network. It's super important to know that and to change or advocate for change within your workplace with your employer or get creative with maybe going to your spouse or maybe you're on your parents' plan still and having them have a conversation with their employer so that surgery can take place. The next decision was when to have it. I do have a son and he is in school and I had to align that with his father to help take care of him. So there's a lot of things that go into place if you do have children and lining up the best time for you to be down for a couple weeks because that was an unexpected thing that happened was the amount of time I took off from work was not enough. But I also did not know, nor did my surgeon know just how extensive my endometriosis was. My surgery was planned for an hour and 15 minutes. It was over 3 hours long. Therefore, my healing was going to be more in-depth and extensive than I had planned. With that, if you have a surgeon who tells you it's okay to go back to work 2 days later, red flag. Absolutely not. If you had true excision surgery done, you should be out for at least 2 weeks, resting, healing, recovering, let alone many of you are going to have more extensive endo found and it's going to require 3 or 4 weeks. I tell my patients to plan on the longer side, plan for 3 weeks or more. You can always go back sooner. Is your workplace accommodating? Can you do work from home? If it's physical, you're going to need more than 2 weeks off. You can always go back sooner. Planning that time off of school or work is really important part of your prep or pre-planning. How did I know if I had endometriosis before surgery? And is it important that you know you have it before? No, that surgery is to diagnose and treat all in one. So you may not know that you have endo. You might be super worried that you're going to go into surgery and they're going to find nothing. And I tell my patients every day, I hope that's the case. I really hope that we send you in there and there's no endometriosis or adenomyosis found. There's other roads we can go down to discover what is going on with you and find the root cause of your symptoms. But never in my practice, and I truly mean that to this day, has there been someone who has not had a finding in that OR of a true excision specialist office and OR. Never have they moved forward and something has not been found, adeno, endo, or inflammation or otherwise. So rest assured, if you are working with a healthcare provider and team, such as us at Simply You Wellness, we know how to spot clinically endo and adeno and other diseases moving forward so that you're not going to go into a surgery that's unnecessary. We know how to spot the clinical symptoms and signs of endo. For those that don't know, I have been on an over a decade-long journey. So let's begin with the decision to have surgery. I went through infertility with my ex-husband over a decade ago at the time of this recording, went through failed IUIs, unexplained infertility was my diagnosis, moved into IVF, got pregnant. We did transfer 2 embryos and only 1 implanted. I had no remaining embryos. That was kind of a red flag for me. The word questionable egg quality or possibly endometriosis was finally discussed and talked about at the time of IVF. Fast forward, I was 32 weeks pregnant and I had a huge bleed. I woke up to gushing blood and I was helicopter life flighted to my OBGYN. Thankfully, it resolved. The rest of the pregnancy was uneventful. I did have to quit working and was on rest at that time until I went into labor at 39 weeks. I then had an emergency C-section, and recovery was awful for that. I did not understand why women would elect to have a C-section. I was not well for over 6 weeks. The pain was excruciating. I felt like garbage for in so many ways. There was just so many things in that 6 weeks that was such a red flag, and I was told, "This is normal, this is normal, this is normal." Fast forward, I did breastfeed for a year. At the end of that journey at 12, my son was almost 1 or 12 months at that time, and I got my first cycle back. It was Christmas Day. I will never forget this. I couldn't walk. I couldn't get out of a vehicle on Christmas Day. I had such excruciating pain and leg weakness. Thankfully saved some oxys from my C-section, had to take one, let it kick in before I could get out. I then proceeded to basically sit on the toilet and bleed out for hours after that. I was then told that was normal. And I knew in the back of my mind that something just wasn't right. This just is not normal. This cannot be normal. I did not feel well. From there, every period I had was just so different than from before when I had my son. I did not feel well. I had head to toe body symptoms. The pain was different. I had leg pain, hip pain, pain shooting down my legs, rectal pain, low back pain, you name it. I felt awful. I couldn't work. Let's hit pause there and talk about what my cycles were like before that. So in high school, my mom shared with me that I didn't really complain. I didn't really have a lot of issues. And if you work with us at Simply You, you know that red flags that we look for are talking about how old you were when you got your cycle. What were those periods like? Were they painful, heavy? Did you or would you have missed school if someone would have let you because of your periods? Did you go on birth control because of your periods? I eventually did. My mom said as I got older, my periods did become more painful, and I went on birth control to help with that. And that is the story that many of us women have that led us to birth control. Fast forward, I was on it for a very long time, like many of you. So I did not know what a lot of my younger years, what those cycles were really like without birth control. I went off birth control, time to get pregnant. I had a disastrous journey with an IUD for less than 1 year. That's a whole other topic for another day. Disaster with an IUD and wasn't getting pregnant. 6 months in of trying, had a miscarriage. Red flag. No one in my family had a miscarriage. I again was met with resistance and even medical gaslighting from a different provider at that time about that miscarriage. But in the back of my mind, I always just felt like something was wrong. But I trusted my healthcare team, right? I was told everything is normal. I was told this is what unexplained infertility is. Even though my gut told me this entire time there had to have been something going on. Like this unexplained, I, as a healthcare provider, was not able to give, unexplained as a diagnosis to my patients. Like, why with infertility was this okay? Fast forward, had my son, obviously, got divorced. I don't even know what it was. 3 years later, life changed. And I just really didn't care about fertility. Like at one point, I was like, you know what? If I have to go get a sperm donor and be a single mom, cool. That's what I'm going to do. But as you know, or may not know, I did find the love of my life and we got remarried. And there was times where I was like, okay, it's time to get serious again about this. I do want to have kids. I know that. I've known that for certainty. Even when I was with my ex, I knew I wanted more kids. And fast forward to getting remarried, it wasn't happening. And 2 years in to unprotected intercourse, and there's no baby. Like, oh, what is going on? Well, working with my pelvic floor physical therapist, I was introduced to Dr. Adam Duke, who I recorded the episode with. And that episode really got myself thinking again too, okay, it's time to have this surgery. It's time. I actually had been working with many of my patients who had had excision surgery and had amazing results, many of them with Dr. Adam Duke. And I was like, okay, that's the road I'm going to go down. It's time to do this. So again, had to change insurances and decided the right time to do it in the summer when my son was out of school and he could go be with his dad for a longer period of time so I could heal and recover. Travel. I live in North Dakota. I did travel to Idaho for surgery, and winter in the Midwest is so unpredictable. So I did want to wait till summer. I did not want anything to get in the way of this decision. Okay, decisions made. Tara's having surgery. What's next? I changed my surgery date 3 times. I originally had it scheduled for April and then changed it because of my son being in school. I then moved it and actually had a work conflict come up. Fun fact, I do expert witness testimony work for attorneys to defend nurse practitioners. And the court date for a case I'd been working on for 3 years happened in between there. So I had to change surgery. Decided on June. You would think I would go and book the plane ticket, book the hotel or Airbnb and all the things. No, I was, I don't know, in denial. Fear set in. And I did not book any of that until literally Airbnb was about 4 weeks before surgery. Airline was 2 weeks along with the rental car. And I put insurance on all of those, like cancellation insurance. The reason I did that is because in the back of my mind, I wanted to be the person I saw on social media who was getting ready to go have surgery and had a positive pregnancy test. I wanted to be the person who took the pregnancy test before surgery and it was positive and my surgery was canceled. Let's be real. That's where my mind was. That wasn't happening. I was angry at my previous healthcare team for telling me everything was normal and not a one time saying the word endometriosis. The right questions were not asked about my family history because my mom and sister have very obvious signs and they have endo as well. Nothing was ever taken to a deeper level about the why to my infertility, the why to my awful, painful, heavy, ridiculous periods, why that changed after I had a C-section, why that changed after I had my son. I had a lot of emotions flowing through me, and I know a lot of you do too. A lot of you are worried they're not going to find anything in surgery. And we have those conversations and we keep those conversations open because that's a valid feeling and worry to have. A lot of you have financial burdens getting in the way of surgery, insurance restrictions, years and years, multiple healthcare providers telling you you don't have endo. Perhaps you've even had a previous surgery with a OBGYN or general surgeon, and they told you, nope, no endometriosis found here. Perhaps you had a hysterectomy and you were told, nope, no endometriosis here. Everything's gonna be better. Take this uterus out, and you still have issues and concerns and symptoms. There's a lot that goes into this decision, and I am validating that for you. I see you and I'm here for you. I just want you guys to know that I'm here for you. I'm an open book. I'm here for you to lean into when you're going through this decision-making process to decide if surgery is best for you. Please reach out to me on social media. I'm here for you. Know you're not alone in this. And I think you should really surround yourself with a healthcare team and a healthcare provider who can walk you through that. Whether it's myself, my staff, or others, you need to feel heard and feel supported. They should be supporting your journey to see an excision specialist. They should be supporting your journey to understanding, do you have this or not? Not one provider holds the answers to everything. And if they say, nope, I know all, be all, end all, you have it, you don't have it, I took care of it all for you, you're still having symptoms, it's not that. Again, there's just so many red flags that I see. The most concerning one is when a single provider thinks they hold the answers to everything and does not include other healthcare providers and say, hey, you know what? I just might not be the right one for you. Or I'm not sure, maybe I missed it. Maybe I missed it in surgery. Maybe I'm not the one that can be the only surgeon to give you that answer. Let's send you someplace else. If that conversation isn't happening, it's a red flag. Surgery's booked, and the surgical place will go forward and do prior authorizations for you to ensure that your health insurance is going to cover this for you. They're not going to do a surgery and not ensure that they're going to have coverage for it. So there's a lot of processes in place to help explain that and help with the insurance process. That is not something I want you to worry about other than if the provider and facility is in network to make sure you're able to use your in network benefits because they should be. They are trained and they should be in network. My journey then was set for June 5th of 2024. I finally had everything booked. I did not pack until the night before I left. Quite literally, the night before we flew out the next morning, that was when I packed. Again, there's just a lot of emotions and denial. I did not go have my pre-op ultrasound done. Whoops. Sorry, Dr. Duke. And I did not have my lab work done for pre-op. I got to his office. We flew out there, and I'll share more about that journey of flying out there. But I got out there. He's like, "Are you in denial?" And I was like, "I am. I very much so am." Again, I am just like you guys going through this. I had just been met with so much resistance up until that point, been told so many things are normal or not a concern. I don't know. To this day, it's very emotional. In my head, it's like scrambled soup of what goes through my head when I think about this process, but anger. And I did go through a lot of the grieving post surgery. There was a lot of emotions that came forward post surgery. So, what I want to do in ending this episode is just validate and meet you where you're at. It is not an easy or quick decision to move forward a surgery to determine if you have it and then address it if you do have it. And the care that goes along with leading up to surgery, if ever, or taking care of you on the backside of surgery is a big decision and a lot goes into that. And you need to have the right team in place. So we're going to talk about what that team looks like coming up in other episodes. My pre-team before surgery was pelvic floor physical therapy, acupuncture, supplement. I did a lot of body mind work with some providers that do alternative cares for body, mind, and soul, I guess you could say. I really was working on my relationship with my now husband, and is he able to take care of me? When does it work for him to get away to be able to take care of me? My mom was willing to step in and take care of me, my sister. I did make sure that those individuals were available to help should I need that. Work, having things set up at work. When is a busy season for your work? When are you going to be able to take off for that? And really just having an employer that supports you as you do move forward with surgery. I am obviously my own boss, but I was bringing on new providers and training them before I left. And I left them when some of them were still very new to the position. And that created a lot of uncertainty for me and making sure I was able to help them and not just leave them. Bye. See you later. Going to have surgery and putting some systems and tools and communication and things in place for them. So even if you are self-employed, I understand how hard that is to just take off. And my patients, I had to reschedule some of you, and that was really hard for me. I did not take enough time off of work. I know how hard it is to get in with me and my staff. And so I had a lot of guilt and ick with having to reschedule some of you. So just know, I know it's not an easy decision to get to the point of making that determination is when and if surgery is right for you. The journey you have had leading up to that conversation is hard. Again, it's misdiagnosed all the time. It is not talked about enough, and that needs to end. And I hope that today, perhaps you'll just be more willing to have the conversation of, is surgery for endometriosis right for you? And if so, when? And who's going to be on your care team? So I want to keep this somewhat shorter. It's already double the time that my podcast episodes usually are. We have so much more coming. I have the 40 questions ready to answer that many of you brought forward, and we're going to keep this conversation open. We're going to prepare you. Should you determine that surgery is the right decision for you, I'm going to prepare you with all the tools needed to be successful in pre-op and post-op for your care team. at home to take care of you in the right way. And just know you're not alone in this journey. Again, I'm here for you. There's a whole community of endometriosis warriors, adenomyosis warriors here for you. You're not alone. Thank you so much for listening to this week's episode. I'm so excited to be back. I'm back. I'm back. I'm back. We're going to have so much more to come in 2025 as we move forward with more Hopeful Hints podcasts. Stay tuned. Hit subscribe. Say hi over on YouTube, on social media. Dr. Tara Harding. I am here for you. You are not alone.